Aloha, welcome to Healthcare in Hawaii. I'm your host and moderator, Josh Green, physician on Big Island and state senator, chair of the Health Committee. Today, before we start, we wanted to take a moment and pause and reflect on a great loss that occurred last Wednesday. Last Wednesday, we had a tragedy in our state, in the state of Hawaii. We lost Director Fuddy, Deliana Fuddy, in a plane accident after she was visiting Molokai. The Director of Health is the mayor, by definition, of Kalaupapa, and she was doing the good work that she's always done for our state in visiting Molokai, taking care of the people there, listening to their concerns, and fighting for good public health. For over 30 years, Director Loretta Fuddy, known affectionately as Deliana by so many people dear to her, was a pioneer and crusader for good health in our state. Deliana came up through the system as a social worker and gradually insinuated herself in a positive way in so many things in health, culminating with her designation as Director of Health in the Neil Abercrombie administration about 3 years ago. She also had a degree from Johns Hopkins, one of the most preeminent public health institutions in our country. She was a wonderfully intelligent woman, a witty individual. She was loved by so many in her department. There are about 5,000 employees in the Department of Health, and we've spoken with many of them over these last several months as we've pursued healthcare in Hawaii on this program. I harken back to 3 years ago when we had the hearing to confirm Deliana. There were 150 people who all poured their love out in front of the committee on how extraordinary an individual she would be as Director of Health, and that proved to be true. In the last 3 years, she's crusaded on so many issues on public health matters here in our state. Some of them we're going to speak about today. Deliana was, like I said, a very heartful person. She took to heart her job. She reached out to her team. They always felt backed when she gave them an initiative to pursue. They knew that they could pursue it as professionals with science at their back without worry about the politics of some of these issues. And that was reflected in many of the things that she did in the last even 12 months. She was a leader on childhood obesity, which we're going to deal with today. She was also a crusader against smoking and worked very diligently on all kinds of preventive health measures. She was the leader of multiple task forces, and she was always a present face at the legislature, really speaking truth to power, I would say. Director Fuddy came to us many times and said these are the right things to do, without concern for what political ramifications or questions might be asked. So she really was an extraordinary woman. Some people asked me the day after Director Fuddy passed what I thought about her death, and I'll tell you this. It was an absolutely bittersweet moment. Bitter because we lost a really wonderful person. Sweet because just the day before her passing, the state of Hawaii was redesignated as the healthiest state in our country among all 50 states. And I really can't think of anything that a director of health could be more proud of. Her team delivered for her. It was the hard work of the many hundreds and thousands of people that worked with her at the Department of Health. And so for those 24 hours before Deliana passed, I know that she had in her mind that extraordinary achievement for Hawaii becoming the healthiest state in our nation. So I really wanted to say farewell, Director Fuddy. We will miss you. The Department of Health has many people that look up to you still and will follow your leadership for years to come. Today we're honored to have a person that the director was able to mentor and work with as a colleague, Lola Irvin from the Department of Health. Lola's job is technically the Tobacco Settlement Project Manager, but she's also an expert on childhood obesity and has really been leading the charge with the leadership of Director Fuddy for these last couple of years. So I thought this would be a very nice way to honor the director by having one of her best captains here to discuss public health with us today. So welcome, Lola.
Thank you. It's an honor.
Yeah, so I'm so pleased that you're here. Why don't, before we get going on this issue, why don't you tell us a little bit about Director Fuddy and give us some recollection about her as a health leader?
Okay. She was a master at coordinating, and she was somebody that made sure we were all linked to what was happening nationally and locally. And she was also bold and called us to be courageous. So when it came to childhood obesity, she challenged us to do what is right because it was right for the children and families.
Yes.
And, everybody had a name and a face for her. It was, we work on population-based health issues. At the same time, we were always reminded that it was about the children It was about our families. And the thought of individuals was never far away from her mind. And I think she really put a heart to what we do. And we remember her for that.
She's extraordinary in that way. I reflected for the first few days after her passing about how she was so different than many directors, and we've seen many wonderful directors in many levels of government, but Deliana had a special bond with her people. There's no question about that. She really came across as a human companion and partner rather than a boss at the Department of Health, and I think that that's reflected in the good attitude at the department, the hard work that she got out of her team, yourself included, the many extraordinary presentations and battles that have been waged and won at the department for good health in our state. So I think that it really is a unique situation to lose her here 3 years into her tenure as Director of Health, but also with a good foundation. I think I didn't feel the next day that we woke up and we didn't know what direction we were heading. I think that many of these issues will have legs going forward. I spoke with the deputy directors immediately, and they named numerous programs that Director Fuddy was committed to that they wanted to make sure were honored and would proceed, and so you can be sure that that will be the case. Today, I think we have a good opportunity to talk about one of the issues that Deliana was most passionate about, and that's childhood obesity. She took to heart because of her background, her roots in case management and sociology and actual social work, the need for children to be healthy. I think you know as much or more than anybody in the whole state about childhood obesity and what the circumstances are right now on the ground in Hawaii. And so I'd like to talk about that today and then talk about what you think we might do to solve this problem. For those who don't know, childhood obesity has become basically an epidemic in our state. I'm going to let you describe those numbers, but a couple numbers that you've taught to me, things that just people should know, I'll toss out. Let's see, some of the numbers on actual obesity. Right now in our state, 15% or 42,000 children and adolescents aged 2 to 19 in Hawaii are obese. Among Hawaii high school students, 10.5% in 1999, but 14.5% by 2009 were obese. So this is a big problem, and we all know that this will lead to diabetes and heart disease. So why don't I turn this over to you, Lola? Tell us about what's the challenge here in Hawaii? What's the landscape as far as childhood obesity goes?
Okay, so with our children, in the 2012 data, we did see the youth obesity rates go down, and we're hopeful that some of the policies and environmental changes going into effect and have been in effect are impacting our children. So our youth obesity rates are 26%. So 13% obesity, about 13% overweight. That brings us back to about 2005 levels, which is really encouraging. Our adult obesity rates, combined overweight and obesity, is about 56%.
I'm going to hold up this chart actually, and I'll hold up a lot of charts today if people can take a look. These are provided to us by Lola in the Department of Health, and you can see some of these numbers here, that 56% rate.
Right.
Tell me more about that and children.
So we know that what happens in a home is going to impact then the outcomes for children. And looking at the kindergarten data, so it's not just what happens in the school. So about 28% of our children in 2 time points when the data was assessed, 28% were overweight and obese. So we know that, it's a matter of what happens in the homes, but it's also a matter of what's available environmentally.
Yes.
So when we look at then physical activity rates, our physical activity rates for both adults and youth are low. Yes. Less than a fourth, close to a fifth of our adults and youth meet the national physical activity recommendations.
You mean that just 1 in 5 are meeting the actual
Yes.
need for exercise out there every day?
Mm-hmm. And then only about 17% of our youth report eating fruits and vegetables 5 times a day.
Right, I think I have a graph on that too, which I'd like to show. So one of the messages is eat your fruits and vegetables, and you're much more likely to avoid obesity. Is that correct?
Yes.
These are the numbers that that Lola had for us here today, and it reflects these numbers. It's less than 1 in 5 are eating right, and that's a big problem.
It's a big problem because it means they're displacing it with other things that are not as nutritious,
right,
and are also obviously energy dense because we've got an epidemic of obesity.
Right. Now, was this always the case? I mean, give us the big picture, I guess. Harkening back 30, 40, 50 years, we hear stories that we didn't have nearly the challenges we do today with obesity. Is that true? Yes,
it's true. And so what we have is really, some people call it an epidemic of sedentary behavior and an epidemic of poor eating. It's only been in about the last 40 years since we've had an introduction of processed foods. And so things that are packaged high in fat, high in salt, high in sugar, and readily available and inexpensive.
Right, cheap foods, as opposed to, a lot of people have said this is a socioeconomic challenge, that if a person tries to eat these fresh fruits and vegetables 5 times a day, which is the recommendation, that we all kind of come to agree on, it can be quite expensive, and people who are living at or near the poverty line, they might never be able to do that, yet they can go and get fast food and get a meal for $2 or $3 sometimes. That's one of the big problems. Yeah.
Right, so it's a challenge, and when we say 5 times a day, that's actually minimum. So people should be eating it even more often. So one of the things that we worked with Deliana, our director, Fuddy, was the challenge of making fresh fruits and vegetables more available. And something that has happened across our counties is the availability of EBT transactions in the farmers markets.
Right.
And so City and County of Honolulu actually passed a policy. So in the 26 People's Open Markets, there will be EBT transactions happening.
This is fantastic. I was so pleased that was one of the issues that kind of rose to the fore. I think we'll talk a lot more about this in our second segment, but you and the director have convened really a major task force that's on obesity, and at first it begun with childhood obesity, but I think if I'm not mistaken, we expanded to obesity of all ages, and that was one of the questions. Can we find a way for people on, I guess, the EBT cards, or food stamps historically is the other way people describe them, but for people who need some support and help, that they can use those. And I was at actually an open market up in Hawaii this weekend, and there was people were shopping around, and I tell you that there's a lot of people that are fairly poor, living in the countryside on the Big Island, but that market, that farmer's market, was overwhelmed, and there was no sense of shame. It was really just like going through and getting some transactions going so that you could go out and buy eggplant and buy fresh bananas and whatnot. And I think that's going to take care of a lot of our health challenges. So this is a good opportunity. Why don't we take our first break here, and when we come back, I'm going to ask you several questions or have you expound on the full scope of the obesity problem, what you expect, and we'll begin to dig into some of the solutions.
Okay.
Great.
Thank you.
So today, this is again Josh Green with Healthcare in Hawaii. We're dedicating this program to Director Loretta Deliana Fuddy, our deceased leader in the Department of Health, died last week. She was a wonderful shepherd for us on healthcare policy, and not 48 hours before she passed, Hawaii was named the healthiest state in our country, and that was much credit goes to Director Fuddy. We'll be back in a moment.
Aloha, I'm Jay Fidel for ThinkTech. For nearly half a century, the Hawaiian Foreign Trade Zone, number 9, has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. D.Ed, the Hawaii Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program. It does so to encourage international business and economic development. The Foreign Trade Zone mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Jay Fidel of ThinkTech. Mahalo.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, physician from the Big Island and State Senator. Today we have an interesting show. I'm hosting really a dedication to Director Loretta Fuddy, who passed last week in a plane accident. She was our Director of Health and a critical leader on all matters relating to healthcare in our state, culminating with Hawaii being named the healthiest state in our country. One of our chief lieutenants is with me today, Lola Irvin, who's been fundamentally dedicated to many of the same issues that Director Fuddy was focused on, and those are prevention. Today we're talking about childhood obesity and its impact on our state. In our first 15-minute segment, Lola was able to tell us a little bit about the scope of the problem in obesity, and I'm going to have her dive further into that issue and begin to talk about some of the solutions that can be had here in our state. She also is going to touch on the fact that this is not such a simple question, that there are some social equality and justice issues at stake here, a theme that's come up on our shows before. So Lola, we established that there's significant obesity. Tell us a little bit more about that. What are we going to see 10, 15, 20 years if we keep on the same road?
Trust for America has calculated that if we keep on this road without major policies and interventions in place, in 30 years, half of our state will be obese.
Wow, half of our state in 30 years. And does that mean half of our state will have higher risk for
chronic diseases, all of them: asthma, diabetes, cancer, heart disease, and stroke? Yes.
And one of the things that's been a theme for our program on several occasions has been that we have a fundamental shortage of providers, particularly in rural areas: nurses, nurse practitioners, physicians. So it's sometimes challenging, as people know, if you're Medicare or Medicaid especially, to find a doctor. But I can only imagine if we were to stick on this road and we had these massive increases in problems with diabetes, asthma, heart disease, what will we do? So I guess basically what we're doing is we're saying, okay, team of Director Fuddy, you guys are our leaders, our thought leaders on prevention. Help us to change the trajectory. You mentioned earlier that already we're seeing a little bit of a dip in the obesity rate, that we're returning back more towards 2005 levels. So expound upon that. What are we going to have to do to really turn this into a healthier society where we have very low obesity rates?
Right. So when we look at the lesson from tobacco prevention and control, what we put into place are policies, so higher taxes for cigarettes and other tobacco products.
Mm-hmm.
We also banned the use of cigarettes and tobacco products in the workplace and in public places. We also provided opportunities and help for people to quit smoking and for youth to not start. So what we essentially did was a social norm change.
Okay.
So that if someone enters into the elevator with you and me, we'd look at them like, where have you been? Because our norm says we don't smoke in public places.
And it's changed so quickly, because I remember flying in the 70s when people were smoking on planes, and to tell my children that, they're just, they're befuddled by that. And I'll tell you what, I think any one of us would be totally shocked if we were sitting next to someone on a plane now and they started smoking. So let me try to unpack that a little bit. So there was very significant efforts put into smoking cessation and changing the social norms, so that now it's much less likely people start smoking early and we don't see smoking in public places, so on and so forth. Are you suggesting that the obesity model and dealing with very significant increases in obesity is going to follow that model? How would you explain that? How would it be done? Would it be through soda or other high caloric foods that are not healthy? What do you think?
So what we're doing is we're looking at it from a socio-ecological approach. So when we think in terms of your family and mine, and we think in terms of what influences us, way up at a high level would be the policy and systems and environmental changes. In terms of what happens at the state capitol where you work, and the policies that determine then the choices we have. And things like price differentiation might be one of them. The other would be then in terms of a system. So we have one public school system. And something fantastic that happened was that the Department of Ed, through the Board of Education, passed the wellness guidelines. It's one of the most comprehensive guidelines in the United States. And so part of the wellness guidelines, besides meeting USDA requirements for whatever food is served, says that in the vending machines, no sugar beverages. And in fact, in all the schools, you'll see water. And we think that that helped contribute to the lowering of the youth obesity rates, since that is one of the major contributors of calories for our youth.
Let me put a statistic out here, right? Forgive me for interrupting it all, but you sparked some memory that I had. You once told me that each additional 12 ounce of sweetened beverage soda that's consumed per day by a child increases his or her odds of obesity by 60%.
Yes.
We still know that that's a number that's reliable?
It's still reliable, and in fact, we went back and polled our youth because we had the Rethink Your Drink campaign.
Right.
And what we found out was that almost 100% of our youth said they drink some kind of sugary beverage every week. And more than half said they drink something every day. And on average, it's about 8.6 times that our youth are drinking sugary beverage, and that's not servings.
Wow.
And so when we think in terms of, you know, if a youth has an opportunity to buy something large versus small
Right.
for close to the same price, we're not talking about a 16-ounce drink. So when we think in terms conservatively about the calories, yeah, it comes up to about 10 pounds a year that the youth will put on.
See, that's, and as a physician, I can tell you that those 10 pounds per year over the course of, well, the math is simple, over the course of 4 years of high school is 40 pounds, and that will tip someone from being in good health to morbid obesity. And the difference between being in a good health range with a good body mass index that's healthy and being all the way out here means absolutely higher risk of high blood pressure. High blood pressure will mean higher risk of stroke or heart attack. All of those also contribute to diabetes. So I think when people are viewing our program and when they're reflecting on why is there so much attention, for instance, on the laws that were addressed in New York where they talked about the size of beverage. Now maybe people don't like to be treated like children. We all recognize that. But when you make a soda only 5 cents more for another 10 ounces or 12 ounces, it's directly contributing to obesity. And that obesity directly contributes to the cost of health care. And I think that is not lost on society with the Affordable Care Act discussions we're all having. Of course, I guess if we could wave a wand and just everyone make good decisions all at once, we would never need these pieces of legislation. Is that right?
Yes, and that's where then the wellness guidelines actually change the environmental choices for our children in schools, and so that's made a difference. The other thing we learned was that media makes a difference, and so the Rethink Your Drink is actually a counter-marketing message. And so in terms of the media environment, putting that message out there, more than 50% of the youth said they saw it.
Interesting.
And 60% who saw it said they switched to water.
Wow.
Which is fantastic. So we need to do more of those kinds of interventions in the media environment. The other thing we need is in terms of the community level to see the environment change. And so if you as a physician told someone, okay, now I need you to increase your physical activity.
Right.
As a child, get 60 minutes a day. As an adult, get 30 minutes and mix it with vigorous and aerobic and weightlifting activities.
Right.
If they step out their door and they live in a neighborhood without sidewalks, without the opportunity readily available to be physically active,
Right.
when they're motivated because an authority figure has told them, get physically active, that's going to dampen their motivation because they won't have the opportunity. And so changing the built environment is really a social justice issue.
Yes.
If I live in Kailua and I have sidewalks, but a child living in Waimanalo doesn't have sidewalks, why not? Why isn't there equity?
Yes.
And why isn't there equity in terms of that child being able to walk to school as an option? Why don't they have that option to get there safely? So that was something too in terms of for Deliana. You know, she really cared about the kids and about equality, no matter where you lived, that there should be a caring, nurturing environment for that child. And that makes a difference in terms of the behavior that can be, well, one, practiced as well as sustained.
Is this something that Deliana was fighting for? That she was fighting that when it's so funny because people think, okay, healthcare policy must fit into this one simple, neat little box, but it doesn't really. It sounds to me like you're talking about development and infrastructure, which often falls into a much different historic dialogue. But you're saying that the director and your team were asking that developers, when they come and do master plans, that they include walking
Yes.
communities?
Yes.
Okay, is that one of the recommendations, I guess?
It is one of the recommendations, and in fact, Hawaii has been really progressive in that we actually have a complete streets legislation. We have 2 safe routes to school legislation that's been passed, which is kudos to the legislature and also to our leadership. And then Deliana was looking at implementation. Hey, let's make it happen.
Right.
She also wanted to see a bike share program available in Hawaii so that people could also bike and make active transportation part of the day, because frankly for a lot of us 30 minutes in one big chunk might be difficult, but if we can break it up into 10 minutes,
Right.
or the child and their family can break it up into 10 minutes and make it up into 30 minutes or 60 minutes total,
Yes.
that meets what our bodies need at a minimum. So yeah, that is one of the things she told us, to be bold and to go and work on, because it's a public health and it's a social justice issue.
And I'm so pleased to hear this, because you're really giving us a good picture of what her vision was for health. And that's also a big challenge, because it's one thing to kind of joust with people on health issues, and a lot of times we get to consensus quite quickly. But when we're talking about the development world, where there's just billions and billions of dollars that are being invested, it's a different fight, and it's a real challenging fight. So I think that's testament to her courage also. Okay, so I guess if I'm going to reframe this discussion, we began with the statement that we have an obesity crisis, and we saw those numbers. We also have had some encouraging signs that children's obesity is falling off a little bit, hopefully because of activities that were done by the Department of Education and Department of Health at the schools. And now we're moving into the realm of better diet, which also we're seeing at the schools, although we need people at home to work on this. And then finally, these walking communities, these active communities. So these are the strategies that are emerging. Tell us what else. What are the other kind of things that are on your radar and more on Director Fuddy's radar that would move the needle on this obesity problem?
So as part of the social norm, one of the things she really cared about were babies. And so at an institutional level, then she supported efforts to have baby-friendly hospitals and maternity programs. And so it's really been fantastic in that most of all the maternity programs across our state participated with the Department of Health in baby-friendly training. That means that the facility, the staff at the nursing facility, the nurses learned about supporting exclusive breastfeeding.
Got it.
So upon birth, the mothers, it would be assumed, and would have all the lactation counseling and the help available to exclusively breastfeed their babies. And so that upon discharge from the hospital, the moms would be breastfeeding and not relying on a bottle.
Tell me how this impacts obesity going forward. What's the research on?
So the research shows that in terms of people who are obese, and doing the study on just behavior and opportunities, that breastfed babies are less likely to become obese as adults.
Great.
So, and then when we think about it in terms of the natural feeling of being full, being exclusively breastfed, the baby gets to regulate that versus somebody externally putting a bottle in and trying to, determine how much the baby ought to be drinking.
Right.
And then there's also the natural bond. Biologically, it is the natural thing to do.
Right.
But yeah, that was something she supported us on, and it's been fantastic. We've had over 700 nurses trained in Hawaii. So it's a good start for our babies.
That's great. Well, I think this is a good place for us to take our second break.
Okay.
But I think we're really digging deeply into this challenge and the history of childhood obesity, and I'm so pleased that you're being very candid with us about Director Fuddy's impact. So we've got about 15 or 20 minutes left in our program, but we'll take a break now. I'm Josh Green, your host on Healthcare in Hawaii, here with Lola Irvin, who's a leader in health policy, and we're dedicating our program today to our deceased leader, Director Loretta Fuddy from the Department of Health.
We want to thank our underwriters. Hawaiian Electric Company and its affiliates Maui Electric on Maui and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle and Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the gas company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
I'm Nicole Horry. Thanks so much for joining us on ThinkTech.
I'm Maria Kashem. See you next time.
Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, State Senator and physician on the Big Island. Today we're joined by a good friend, Lola Irvin from Department of Health, who runs the Tobacco Settlement Project. She's the manager of that program. But I asked her today to join me because she was one of the troops, so to speak, for Director Deliana Fuddy, who is our Director of Health, who passed just 6 days ago in a tragic accident. Director Fuddy was taking on major challenges in the health arena. She was fearless on this front, and she was really working hard to be candid and scientific in her approach to making us a healthier state. In the first 30 minutes of our discussion of the 60-minute program, we've been looking carefully at childhood obesity. And why is it such a big deal? Well, for one reason, 72 million Americans right now are obese. That's 27% of those in our country, and many more are overweight. As people are obese or overweight in our country, it's been linked very closely and carefully with childhood obesity. So this is one of the fundamental prevention areas that we can work on. Individuals who end up heavy, we don't judge, but we do say you're going to have a higher risk of diabetes, you're going to have a higher risk of developing heart disease or stroke. All of these issues are important to us as a country, and it's really important that we look out for people and help them with their health when possible. We've established before many times that personal responsibility is key, but also many of the things that Lola and Director Fuddy put into place for our state have begun to make a significant difference. Back several years ago, there was no more soda in the machines at the schools, and we've already begun to see a decrease in obesity, and we believe that may very well be connected. In our last 15 minutes, we talked quite carefully about the impact of having walkable areas in town to live. And if people have a walkable community, they are much less likely to be unhealthy and have obesity. But there's just so many things on this matter that I'd like to discuss, and I think we're going to now move some of our discussion, if it's okay with you, Lola, specifically to, again, the soda consumption. You guys ran significant ads. I'd like to just kind of get your input on what do you think, whether they were effective. Maybe we'll talk about soda tax, but why don't you weigh in on all these things?
Okay. Well, in terms of learning more about sugary beverage consumption, and so there's such a wide array of beverages available for our youth, and so we found that the girls favored the sugary teas and coffee drinks, and the boys favored the sugary sodas and energy drinks, but combined then 8.6 times was the average in a week that they were drinking that.
And I think you gave me this this visual, daily sugary soda consumption, and it showed, these are the percentages, is that correct?
That's with, that's a real conservative, that's only sugary soda for adults in blue and high school students in brown.
Okay.
And so when we look at that, we can see that males consistently, as adults and youth, drink more sugary soda. And then when we look at our obesity rates, we find that our males are heavier.
Yes.
But what's also really frightening is that in terms of by race and ethnicity, our Native Hawaiian and our Pacific Islander population youth are heavier, and then as well as our adults. But as you've seen in terms of for diabetes risk, our Asian population has a lower cutoff for risk at overweight and obesity, and then for diabetes, therefore. So this thing with the amount of sugar that we're consuming is impacting all of the people in Hawaii and impacting all of our families.
And it's, and it's not just sugary beverages, it's other sugary foods, and like you mentioned
Yes.
earlier, processed foods. But it does speak to a major problem in our society, and in some states, and even in our state, there's been discussion about a tax or a fee. Tell me about that. I know that it meets with, as health chairman, I can tell you, it meets with significant resistance to have any tax on any product. People are wary about that. Would it make a difference, do we think? I can speak to you candidly in this way. We saw that tobacco taxes, when they went up very significantly, we saw a direct correlation and decrease in youth smoking. Is that what we would expect from, a 1 cent per ounce tax on soda? What would happen?
So that is one of the national recommendations from public health experts, and it is something that has been studied where they've done demonstration projects for price differentiation. So when prices were increased for sugary beverage, and of course then it's a point of decision making. People tended to go for the healthier items. So that is what we are hoping to achieve. And it would be a fee. In 2013, the governor had proposed a fee because instead of a tax, the fee would go directly to public health campaigns that would then address childhood obesity. So if the issue is that, for example, lack of resources, which is where we were at with tobacco prevention and control about 13 years ago, before we got the tobacco settlement dollars. Likewise with the fee, we would actually put resources then into providing more recreational opportunities. Perhaps it could go towards PE, and perhaps it can also help supplement the school food services and help with providing attractive foods. I mean, right now they are healthy, they're balanced, but there's also more work we might do in recipe development locally. And we're using some of the tobacco settlement dollars for that. Our program's called the Healthy Hawaii Initiative, because that's what it's about, right? It's about creating a healthy Hawaii and that being the norm. And so, yeah, there would be an opportunity with a fee to change behavior through an environmental change, as well as then providing the resources then for childhood obesity prevention programs.
And it's interesting because I've spoken even with some of the individuals that work with the industry, the soda industry, and they've told me kind of matter-of-factly that they don't mind what people buy. They of course, I guess, want to be protective of their business model, but they have, at least made the overture that they're trying to decrease the number of calories in their drinks, and I applaud that. However, it still seems like a long way to go, and when we see correlations that are this strong between childhood obesity and adult obesity and consumption of empty calories, which the easiest culprit to pick out, I guess, is soda, makes me wonder. I think that it came out in our hearings last year that 6 or 7% of everyone's calories these days on average in America is soda, and someone made light of that, and I tell you, that's a shocking number, 6 or 7%. I mean, that no other food group seems to get anywhere near that in my mind. So it seems like at least an area where we should be addressing, if nothing else, through public health literacy, which you and Director Fuddy once again had spent innumerable hours pursuing. What was the response to the ad that you guys ran? I saw it a lot of times.
Yeah, it was really successful. So we're running it again because more than half of the youth, and our population was youth. We were targeting youth. And so we've heard complaints from adults saying it's gross, and we said, well, it's for youth, and it gets their attention. And we focus group tested it with youth, and they said that is the one that grabs us and informs us. So more than 50% said they saw it, and 60% who said they saw it changed their behavior and switched to water.
I love it. I'll tell you, I'll be candid with our audience. What's gross is when I see someone come in at age 41 with a big heart attack, or I've actually had to help with some cardiac bypasses, and I see the coronary arteries laden with plaques, from someone that needs bypass at a very early age, and it's from the multiple problems they've had, which are diabetes and obesity essentially, and those are really the sad and I guess we could use the word gross moments. There were many associated with tobacco. Of course, the black lung pictures that we saw and all of the public health campaigns, which I think had a profound impact on our society. But I think we're seeing some of the similar patterns in society today relating to obesity, and I'm really proud of you guys for taking up a direct fight, because I see all those fluffy ads that Coke and Pepsi and others have run, and it's difficult to counter them, but you guys keep up the strong fight. That's going to be very helpful. You told me before our last break that Director Fuddy was also very interested in workforce wellness initiatives. Can you tell us a little bit about that? Because our employers are very intimately involved with our healthcare system in Hawaii with the Prepaid Health Act,
Right.
and we're a small town community. So what was she getting at with that program?
So she was really thrilled in that we had the Obesity Prevention Task Force, and we also have a state physical activity and nutrition plan. And one of our partners started the Health at Work Alliance. And in the first meeting, when UHA invited employers, they expected 30 people, and that first meeting had more than 100 employers.
Wow.
And so they invited our director to come and speak about the state physical activity and nutrition plan.
Mm-hmm.
And she applauded their efforts and said, well, look at that, in terms of Objective 16, that's what you're working on in the state plan. And, she held every one of us accountable.
Right.
And so we have a state plan, and she told us, you need to change what's happening in the workplace. And so one of the things that she also, besides looking at it at a state level, she also challenged us to do it departmentally, and to put together a worksite wellness program as a demonstration project, as well as nutrition guidelines. And so we are committed to moving forward with that.
Yes.
It is something that we agree is very important, and it was part of the vision of the director, make the Department of Health a healthy and great place to work.
And leading by example makes a big difference.
Yeah.
It's, people ask me a lot of the time, why politics? Why are you just go be a doctor? And I say, well, it's very difficult to pass legislation, if I can be frank, and people have very different views, and I respect that. But some of the best moments are when you get to simply lead by example, whether you're out there walking and you're showing that that's a healthy decision, or not drinking excessively and showing that that's a healthy decision, because alcoholism can be destructive. And I think the same thing can be said about obesity and general wellness. Not everyone who's heavy, it's not always their fault. There's no question about it. But we can all work on that. We know there are genetic issues at play, and we're very mindful of that with the Polynesian culture. But some of these health disparities are pretty gigantic, right? And I've seen some of the numbers where certain subsets of our society have very, very high risk for obesity. And so you're saying that the combination of these things we mentioned earlier, better healthy choices on foods, having 5 or more vegetables a day or servings of vegetables a day makes a difference. 30 minutes of activity a day for adults and an hour a day of exercise for children. So I'm trying to remember and learn. And now this healthy workforce initiative, all of those things, is that the silver bullet? Is it those 5 things? And I'm sorry, the walkable districts and communities. What else do you have in mind before we go to our final break? What are some of the other?
Well, the media environment matters too.
Yes.
Yeah, because we are up against huge odds in terms of the exposure that our children and families have with the kind of advertising dollars that are available.
Right.
That overwhelm our children with just seducing them in terms of fat, sugar, and salt.
Yes.
So yeah, we also need to address that.
Well, I think that you can win, because if I would hearken back, and you can put your other hat on, which is really tobacco, and you were a champ there, you and Director Fuddy for years. They had those same odds. The deck was stacked with a lot of extra dollars on that side, but boy, when the ad campaigns came out showing individuals that were smoking through ostomies in their neck, or individuals that where we saw a picture of a black lung, I think that changed the game. That was a paradigm shift, and I think that that's what you're attempting with media. So again, I applaud you.
Thank you.
Why don't we take our final break, and then we'll come back for 5 minutes and reflect on our past and Director Fuddy's contribution, and then we'll bid her goodbye. Okay. So this is Josh Green with Healthcare in Hawaii. I'm today working very closely with Lola Irvin at Department of Health. We're talking about childhood obesity, and we'll be back in a moment.
Aloha, I'm Nicole Horry for ThinkTech. For nearly half a century, the Hawaii Foreign Trade Zone No. 9 has brought the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs. DBET, the Department of Business, Economic Development, and Tourism, operates Hawaii's Foreign Trade Zone program to encourage international business and economic development. The Foreign Trade Zone's mission is to increase the amount of international trading activity in Hawaii, thereby providing employment opportunities for the residents of our island state. For more information, see ftz9.org. I'm Nicole Horry. Mahalo.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator and Health Chairman in the Senate. Here today talking really, hopefully with some heart, on a wonderful person that we lost a week ago. 6 days ago, actually, our Director of Health, Deliana Fuddy, died in a plane crash off of Molokai, Kalupapa, and she had been a leader for over 3 decades here in our Department of Health. Today, as part of her legacy, I've been extremely happy to have Lola Irvin from Department of Health, who runs the Tobacco Settlement Project. Lola has been her point person on childhood obesity, a critical issue that the director in her life took up on behalf of our children. So I'm going to ask for Lola to give us a few comments about what the future holds here in the state of Hawaii based on Director Fuddy's leadership and stellar example for us as a people here in the state. So we have just a few minutes left. Lola, tell us what you think the future will look like because of the director's actions and leadership.
Well, if I think in terms of a child born into Hawaii, it's more likely that that mommy and baby will have the opportunity for a really healthy beginning. And so mom will have the support to breastfeed exclusively, and then to have the laws in place to help mom if she goes back to work, that she can express her milk and then have it available for the baby to continue then for 6 months at least, right, doctor?
Right. I agree.
So good for mommy and baby. And then for mom, when she goes back into the workplace, she'll have the healthy workplace that's going to support her with healthier food options, stairwells to take so she can be physically active during the day, vending machines that have healthy food options. And then for the child, in early child care, we'll have early child care guidelines in place that will look at and assure at least 60 minutes of physical activity during the day and healthy food options all through the day. Then when they enter into DOE, we'll continue supporting the wellness guidelines in terms of having the healthy foods there, physical activity, PE, health education, and then for then the family, when they're out shopping, there will be the farmers markets, and if they're relying on EBT, be able to purchase fresh fruits and vegetables, locally grown,
Yes.
and then walk home if that's what they want to do, because there will be sidewalks in their neighborhoods. Maybe if they live in town, they'll be able to take a bike and be able to use a bike path to get home as a family. So those are the things I think in terms of how we live, work, and play, it'll be different.
Great. I'll tell you, the way you just described that was exactly the way I think Director Fuddy envisioned it, and her vision and her comprehensive approach to public health was really what set her apart and made her so special for the people of Hawaii. I think that it's safe to say that her legacy is secure, that she was not just an extraordinary director, but an extraordinarily giving and open-hearted human being. I spent just a little bit of time over at the Department of Health the day after she passed, and you could just see the outpouring of emotion at the loss. But as all things are, there will be a legacy for her. We're going to honor her traditions and her passion for these public health issues. It's reflected completely in the people that she had around her in you. It was honored just a day before her passing, when the state of Hawaii was designated one of the healthiest, or the actual healthiest state in our country. And I know it's a tough time at Department of Health, but so many people loved her, and we really wanted to recognize that today. And I'm really just so pleased to have this conversation with you and see that shared wisdom that you and she were working on with the many people around will continue. People should be confident and know that we're going to continue her legacy. We'll be fighting on these issues for many years to come, and we're going to remember her so fondly. She was a very great person. So thank you for joining us today.
Thank you. It was an honor.
So that's what we've got today. We thank you so much for joining us. Please reach out to people in your family, in your community, to work on good health. Please avoid bad decisions that can lead to bad health consequences. I think that was the message of today. We wanted to once again say thank you, Director Fuddy. Thank you for your leadership. Thank you for your vision. Thank you for having these good people around you for these last many, many years on behalf of the state of Hawaii. So we're going to follow your lead and take up the health for all of the people of Hawaii. This is Josh Green, Healthcare in Hawaii. Thank you for joining us. Take care.